Hello everyone, today's video will be about vertigo. Do you guys have any experience like this? So I was at home working on paperwork when I became sleepy. So I decided to lie down in bed for approximately 10 minutes. I used my phone to set an alarm and awake exactly 10 minutes later. Then, all of a sudden, a sound came from my ears and everything became distorted. Then I became disoriented and collapsed on the ground. Fortunately, I did not lose my consciousness and was able to get up quickly, but the experience was frightening. I'm sure everyone has experienced dizziness like me at one time or another. Hi there, I'm Ume from CloudHospital TV, and in this video I'm going to talk to you about vertigo. What is it, causes of vertigo, and some home remedies for this illness. And before we start, please subscribe to our channel so the next time you'll be updated with our new releases. So what is vertigo? Dizziness and vertigo are one of the most common symptoms that bring patients to the physician. Vertigo in the sense of the word spinning and rotating as you think the room or surrounding environment is spinning around you, but they are not. So the number of people who suffer from dizziness is estimated to be about 10%, but it may approach 40%. It is important to say that vertigo is a symptom of an underlying condition rather than a condition itself. So if you suffer from vertigo, you could experience spinning and losing balance. But other symptoms including nausea, headache, nystagmus, which is an abnormal uncontrollable eye movement, tinnitus, which is ringing in the ear, could also occur. A guide to 3 questions about vertigo. We will clarify any queries you may have concerning vertigo, like causes of vertigo, genetic background, and how to avoid it. Let's start with causes of vertigo. Most often, vertigo is caused by inner ear problems such as benign paroxysmal positional vertigo, which occurs when calcium particles that are normally found in the ear dislodge and collect in the inner ear. Meniere disease, caused by a buildup of fluid, which causes changes in pressure in the ear. Meniere disease is usually a triad of vertigo, tinnitus, and hearing loss. Labyrinthitis, an infection of the inner ear labyrinth that may occur if you got a flu or if there is middle ear infection that spreads to the inner ear. Vestibular neuritis, an inflammation of the vestibular nerve. It is the nerve responsible for the balance. Other diseases can be associated with vertigo include migrainous vertigo, stroke or transient ischemic attack, head, brain or neck injuries, ear surgery, certain medications. Is vertigo hereditary? So vertigo as a symptom itself is not hereditary, but the various conditions and syndromes that cause it might be. So if you have current vertigo, you might have a hereditary genetic component. Some examples of conditions or syndromes that involve genetic factors are migrainous vertigo and familial Meniere's disease. So if you have a history of migraine headache, vertigo could be a common associated symptoms which could be triggered by stress, anxiety, consumptions of caffeine, alcohol, and even dairy products, hormonal changes during menstruations, menopause, and pregnancy. Preventive measures for vertigo in pregnancy. Most of the people who suffer from vertigo are pregnant women. If you are pregnant, nausea and dizziness are very common to the hormonal change associated with pregnancy. Consequently, recurrent vertigo and fainting, especially during the first trimester, can increase the risk of a variety of complications such as preterm birth and even congenital abnormalities. So what can you do to prevent vertigo while pregnant? This is preventative measures for vertigo in pregnancy. Standing up slowly and sitting down on the edge of the bed for a couple of minutes prior to standing. Drinking enough water, eating small meals during the day that are rich in protein and other nutrients, regulating stress and anxiety, lying on the left side to keep the uterus from putting pressures on the liver and improves blood flow to the baby. What are some things in vertigo home remedy? So the first step to manage this complaint is treating underlying disease. What's more promising is that vertigo often goes away on its own without therapy, owing to the brain's ability to adjust to changes in the part of the ear responsible for the balance. So what should you do? You should try to relax, as anxiety can worsen vertigo. Sit down the second you feel dizzy. Move your head slowly when performing any daily activities. Get out of bed slowly and sit for a while before getting up. Do simple exercises that correct the symptoms like Epley maneuver. Avoid using caffeine, alcohol, salt, and tobacco. And of course, stay hydrated. On the other hand, what you shouldn't do is stretch your neck, for instance, when trying to reach something high above your head. Bend over to pick things up, like squatting to lower yourself is a better alternative. Driving a car or operating any machines if you experience frequent or sudden episodes of dizziness. Thank you for joining us in yet another video covering key health-related topics with CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.